Angina pectoris. What is angina pectoris? Angina is a chest pain can feel like a heart attack, but often it is a warning sign. Commonly it occurs due to coronary artery disease. Due to atherosclerosis, the narrowing of the coronary artery occurs, and this leads to decreased blood supply to the heart muscles and a deprivation of oxygen supply. Due to coronary artery disease, the inadequate oxygen and blood supply to the muscle layer causes myocardial ischemia. The pain may experience when the oxygen level cannot meet the metabolic demands of the muscle. The person don't always have angina. This is because during the time of resting, the heart muscle may be able to get adequate oxygen without triggering angina symptoms. Angina can be a symptom of life-threatening heart problems. The main causes of angina pectoris are coronary artery atherosclerosis and coronary artery spasms. The coronary artery diseases is the most common cause of angina. The coronary artery can become narrowed by fatty deposits called plaques, and the condition is known as atherosclerosis. This narrowed coronary artery reduces the blood flow to the heart muscles. And the condition causes spasm of the coronary artery also reduces the blood flow to the heart muscles, and this leads to chest pain. Risk factors of angina pectoris. First one is hyperlipidemia. Cholesterol is a major part of the deposits that can narrow the coronary arteries. Increased low density lipoprotein increases the risk of angina. A high level of triglycerides is also undesirable. Hypertension. High blood pressure damages the arteries. It leads to hardening of the artery, which reduces the blood flow through the coronary arteries. Age. Men older than 45 years and women more than 55 years are at high risk of developing angina. Another risk factor is family history. If a family member has coronary artery disease, you are at a greater risk of developing angina. Obesity. It increases the risk of hypertension and cholesterol. Heart has to work harder to supply blood to the excess tissue what we have due to obesity. Another risk factor is stress. Certain hormones produced during stress can narrow the arteries and cause angina. Physical inactivity or exertion. Strenuous physical activity increases the demand of oxygen, which causes increased workload of the heart muscles and leads to chest pain. And decreased physical activities leads to obesity, hyperlipidemia, hypertension, and diabetes. Another risk factor is smoking. Smoking damages the interior walls of the coronary arteries. This increases the risk of plaque deposition. Smoking also causes spasm of the coronary arteries. Diabetes. Glucose imbalances causes coronary artery diseases. The increases in the glucose levels damages the blood vessels and speeding up the process of atherosclerosis. Environmental changes. Exposure to cold increases the vasospasm and reduced blood flow through the coronary artery. The patterns of angina pectoris. Angina is divided into three types: stable angina, unstable angina, and prinzmetal angina. Stable angina or exertional angina. It has a stable pattern of onset, severity, and duration. Stable angina is usually triggered by physical exertion. During physical exertion, the heart demands more blood. When the arteries are narrowed, it's harder for the muscle to get enough blood. Emotional stress, heavy meals, and smoking can also narrow the coronary arteries and trigger angina. Due to the causative factors, there is decreased blood flow to the myocardium. The decreased blood supply causes subendocardial ischemia. As we know, the heart is covered by three layers: the outer epicardium, middle myocardium, and the inner endocardium. The coronary arteries start up in the epicardium and then dive down to supply the heart. If the blood volume reduced or the myocardium is thicker, blood has harder time reaching subendocardium and causing subendocardial ischemia. It is a classic finding of ischemia. This ischemia is to trigger the release of adenosine, bradykinin, and other molecules and stimulate the nerve fibers in the myocardium that result in the sensation of pain. Characteristics of stable angina. It develops during physical exertion and it is relieved by rest or nitroglycerin. The duration of pain is less than 5 minutes and the person can usually predict the pain. Unstable angina. Unstable angina is an unexpected chest pain, usually occurs while resting or with an unpredictable degree of exertion and during stress. Unstable angina is caused by rupture of atherosclerotic plaque. This leads to thrombus formation and this clot occludes the artery. This reduces the flow of blood and the heart cannot get adequate oxygen. This also has subendocardial ischemia and the activation of adenosine and bradykinin and the sensation of pain. Unstable angina should be treated as an emergency because it may lead to myocardial infarction. Characteristics of unstable angina. It occurs while resting, sleeping, or with little physical exertion. Pain lasts longer than stable angina, maybe 30 minutes or longer, and it is unexpected. The pain may not disappear with rest or nitroglycerin. It might be a signal of heart attack. The third type of angina is prince-metal angina. It is otherwise known as variant angina or vasospastic angina. It is caused by the spasm of the coronary artery that temporarily reduces the blood flow. The person may or may not having atherosclerosis. It does not correlate with exertion and can happen anytime. Coronary artery spasm can be occur due to several factors like stress, drugs, exposure to cold weather, and smoking. Due to the spasm, blood and oxygen supply to the myocardium decreased. In this case, coronary artery constricted severely and therefore it's referred as transmural ischemia, which causes the sensation of pain. Characteristics of prince-metal angina. It usually happens while resting. It may be relieved by medications and it is often severe. The symptoms of angina pectoris. Pressure squeezing chest pain occurs at the center of the chest. The pain may radiate to neck, shoulder, back, arm or jaw. The stimulation of the vomiting center due to the sensation of pain causes nausea. Release of the catecholamines leads to hypertension, palpitations, tachycardia and diaphoresis. Other symptoms are fatigue and shortness of breath. These symptoms need to be evaluated to determine the pattern of angina. Diagnosis of angina pectoris. Electrocardiography. This is the common non-invasive diagnostic test records the electrical activity of the heart. The ECG readings are normal at rest. During angina, there is ST segment depression or T wave inversion present in ECG. Stress test. Exercise electrocardiographic testing is another non-invasive test to assess the heart during an activity. Treadmill testing is the commonly used method. Changes in ECG or vital signs during testing may indicate ischemia. Cardiac enzymes. The findings are normal in angina. Rise in cardiac enzymes occur only in case of cardiac muscle damage. Echocardiogram. Sound waves are used to produce image of the heart. This helps to identify the areas of muscles that can be damaged due to poor blood flow. Another diagnostic measure is cardiac catheterization. It is an invasive test involving insertion of a balloon-tipped catheter into the heart through a blood vessels. Catheterization provides information regarding patency of the blood vessels. Angiogram. It uses X-ray imaging to examine inside the blood vessels. A type of dye that is visible by the X-ray machine is injected into the blood vessels to take the images. It helps to identify the percentage of blockage. Another methods used for the diagnosis of angina are chest X-rays, cardiac CT, and MRI scans. This helps to identify the size of the heart and the blood vessels and to identify the extent of the damage. Medications for angina pectoris. Nitrates is often used to treat angina. It relaxes and widens the blood vessels, allowing more blood to flow through the vessel. The most common nitrate used to treat angina is nitroglycerin tablets, which put under the tongue. Aspirin. It reduces blood clotting and making easier for blood flow through a narrowed artery. Preventing blood clotting reduces the risk of heart attack. Medications like thrombolytics helps to resolve the clots and antiplatelets prevents new clot formation. Beta blockers blocks the effect of epinephrine. As a result, heart beats slowly and relaxes the blood vessels and open up to improve the blood flow. Calcium channel blockers helps to relax and widen the blood vessels by affecting the muscle cells in the arterial walls. This increases the blood flow to the heart. Blood pressure lowering medications such as ACE inhibitors can also used to reduce the stress of the heart. The cholesterol lowering medications like statins helps to reabsorb the cholesterol that has accumulated in plaques, helping to prevent the blockage. Surgical treatment for angina, coronary angioplasty and stenting. Angioplasty is an invasive technique in which a balloon-tipped long thin catheter is inserted into the blocked arteries. The balloon is inflated at the site of blockage to open up the vessels and to improve the blood flow. The patient may experience reocclusion after the procedure, so coronary artery stents are used in conjunction with angioplasty to eliminate the risk of vessel closure and to maintain the long-term patency of the vessels. Coronary artery bypass graft. It is performed when the patient is not responding to other therapies. The occluded coronary artery is bypassed with own venous or arterial blood vessels, allowing blood flow to the heart. The main nursing interventions are monitoring pain and provide pain relief medications, checking vital signs and continuous cardiac monitoring, maintain airway by administering oxygen, place the client in semi-fallows position, ensure proper bed rest, and instruct the client to stop the activity and rest if chest pain occurs, assess the client to identify the angina precipitating events, provide diet instructions to the client, instruct the client to take low cholesterol, low sodium, low fat, and high fiber food and to avoid caffeine. Assess the client to identify the risk factors and help the client to modify the risk factors. Educate the client regarding prescribed medications.